Hi, this is Dr. Jessica Hochman. Today we're going to talk about what to do when your child has a cold. Cold symptoms in younger children are incredibly common. In fact, every season about 200 cold viruses are in circulation, and the average child in daycare gets 6 to 8 colds a season. So what we can expect is the average cold symptoms usually peak around the second to third day, and they gradually resolve over the next 10 to 14 days. So what this means as a parent, we can feel like our child is constantly fighting cold viruses. Usually, the common cold symptoms include nasal congestion, runny nose, cough, low-grade fever, and less of an appetite. How can we help treat the common cold? Well, most of the treatment that's recommended is focused on making the child comfortable, what we call supportive care. Saline is one of my favorite recommendations because it's incredibly safe and it works. It's best to use if the nose is really congested, and what you do is you spray a little bit of saline into each nostril and let it be, and eventually the child should breathe easier. And because saline is not a medication, it's salt water, it can be used multiple times a day as long as your child needs it. Another option to help ease congestion is to use a bulb syringe or a snot sucker. Just be careful not to overuse it, as this can irritate the nostrils. I also recommend using cool mist humidifiers for little babies. This can make it easier for them to breathe. And if your child seems uncomfortable and over 3 months of age, you can also give acetaminophen or Tylenol a try. And if your child has a cough, you can also try things like tea, warm chicken soup, honey if they're over 1, and cough lozenges if they're over 6. And lastly, I recommend plenty of fluids. I never underestimate the value in a good night's sleep, and plenty of TLC. Is there ever a time when an antibiotic would be used to treat a cold? Well, in general, because colds are viruses and antibiotics are used to treat bacteria, you can expect that your doctor will not prescribe an antibiotic to treat the cold. There are certain situations, for example, ear infections, pneumonias, sinus infections, where your doctor may in fact use an antibiotic. Now, what about having green, thick snot? Does that mean your child needs an antibiotic? No, actually. Contrary to popular belief, green snot does not mean your child needs an antibiotic. Green snot is just a sign that your body is fighting an infection. A lot of times what we'll see with colds is the snot will start off looking clear and then progress to looking thicker, greener, yellower, and by the end of the cold, it is thin and clear again. Now, what about homeopathic options? I'm asked all the time, do I recommend vitamin C, echinacea, probiotics, zinc, elderberry? And unfortunately in children, while a lot of these may not be harmful per se, there's no evidence to support that they are helpful. In adults, however, there are some studies that show that zinc may be helpful, but these studies have not been replicated in children. Now, what about over-the-counter cough and cold medications? Could these help? Unfortunately, again, there's no evidence to support that they're helpful for children. If you're going to use them, however, I would wait until they're 6 years old. Also, there's no evidence to support that their use is any better than placebo. Now, what are some reasons to call your doctor about your child's cold? I personally like to see all children under 6 months with a cold. Also, if they're having any trouble breathing, if they're persistently congested, if they seem really uncomfortable, maybe it's an ear infection. Also, keep in mind that because most colds turn the corner and get better after a week, if they're persistently sick beyond that, I do like to see them as well. And lastly, an ounce of prevention goes a long way, so don't forget to wash those hands. This is Dr. Jessica. If you enjoy learning about pediatric topics, don't forget to subscribe.